we are following for you tonight. After decades of declining HIV rates, infections in Chicago are rising yet again. The number of cases have been creeping up since 2020, according to a Sun-Times investigation examining city data. But city health officials say the increase is happening mostly among Hispanic Chicagoans, even as rates for other racial groups continue to drop. Here to break all of this down and explain this trend is Dr. Andrew Crone from Howard Brown Health. Thank you so much for taking time out for us tonight.
Hello.
Well, let's talk about this. The Sun-Times article says that in 2024, there were 818 new HIV cases and nearly half are among Latinos. Why is it that the Latino Chicagoan population is being impacted more than any other groups?
Yeah, so I think Elvia Malagon did a really nice job highlighting some of the problems that particular population is facing in the city. And it's in combination of a lack of resources in prevention and also connecting people with treatment, and also the migrant population coming into the city. So we're getting people here in Chicago who have never maybe been tested for HIV before and are learning for the first time that they're HIV positive. And some of those patients may have a very poor understanding of what HIV actually is. Another thing is making sure that the patients in the Latino population here in Chicago have access to prevention resources, particularly HIV PrEP or pre-exposure prophylaxis medicine. It comes in pills and long-acting shots. And when people are taking this medicine consistently, their risk of getting HIV through sex is dramatically decreased. Nothing's perfect. It's pretty darn close, though. But getting the word out that medication is available to patients and also that there's a way they can get it affordably poses multiple challenges. One of the things that I was quoted for in the article is that we see these patients come in, especially people who are undocumented in the city of Chicago, who want access to these resources, but now more than ever are scared to come in and get them for fear that there might be some kind of retaliation against them. Or they might be exposing themselves to some kind of risk of having to leave the United States.
You know, Doctor, I know you mentioned access there. Howard Brown definitely has been on the forefront of making sure that people have access. Can you talk about what you're doing there to maybe help with these trends and bring those numbers down?
Yeah, so we have multiple clinics in the city, mostly up and down sort of the red line, but we also have a location at the La Casa Norte Resource Center in Humboldt Park that services a large Latino population. We really want to make sure that people know that accessing HIV testing and prevention medication is affordable to them. So we do we'll take care of any patient that's regardless of their insurance status, and also we'll make sure that if they want to be on HIV prevention medication, that they can access that at no cost or low cost through various programs that are available, both through the state of Illinois as well as through the drug manufacturers for these medications. And also we have community testing in various places in the city, like we also have Brown Elephant testing, where if a patient is interested in PrEP, Brown Elephant is our consignment shop. If a patient is interested in PrEP, then they can be connected to an appointment to get tested. And we have various community events throughout the city. So it's just making sure that people have access to the resources to know that they can get tested and treated. Another big population that we care about is people living with HIV. You know, when we look at nationwide statistics, about 1 in 10 people with HIV here in the United States don't know they have it. And so making sure that people get tested and connected to treatment. Because if someone living with HIV is taking their medicine, they can live a healthy life that is, you know, largely free of problems or disease. And also, if someone living with HIV is taking their medicine appropriately, they can't pass HIV on to someone else. So we really need to look into how we can connect our Latino Chicagoans into a system where the people living with HIV get taken care of so they prevent spread, as well as people without HIV know the access to resources so they can protect themselves from the infection and get routine testing beyond that. Because some populations are always going to be at risk based off their behaviors and habits, and that's not necessarily a bad thing. There's no value judgment on how we live our lives, but we need to make sure that those people have access to protection from the negative outcomes of that.
Very well said. I want to go back to something that we just mentioned there, Doctor. You talked about the undocumented population, but this uptick really started in 2020. Was there anything else happening during that time period that would have led to more cases?
Yeah, I mean, COVID really is something that we'll see the reverberating effects from in healthcare for a long time. Huge disruption in access to people who normally would seek it pretty readily, when suddenly going out of the house or going to a healthcare center poses this whole additional risk, then that's not something that you're going to do. I mean, people who were previously taking HIV PrEP medication stopped taking it at that time. People weren't coming in for routine testing, and then getting people back on board with those habits is something that we're still trying to focus on. That's really the main thing there. But also, with the way migration and habits changed in terms of people getting connected to HIV care, that's been a long time building. Another thing, that I've noticed too is with my patients living with HIV, if someone doesn't have health insurance and they're of a certain income level or lower, they qualify for government-based healthcare insurance, which can allow them, not insurance, but government-based healthcare drug coverage specifically for their HIV medications and related disorders. So we want those people to still be connected to care so that they prevent the spread of HIV to other people as well as they're healthy themselves. Anecdotally, I had a Latino patient who's undocumented who, once we connected, he was diagnosed last year. I was there in clinic. We did a rapid test. He found out that day. We started him on medicine that day. And he was really good about following up and staying connected, but then he lost insurance through his job. He was undocumented. We talked about getting him signed up for government assistance, and he really did not want to do that because he didn't want to risk, potential ramifications from putting that information about himself out there. And that's something that could largely be avoided if we had, a system that was a little bit different. Another thing I want to bring up. Oh, go ahead. Go ahead.
No, Doctor, we're running out of time here. I wanted you to give folks that may be watching the website if they want to learn more about Howard Brown.
Yeah, so we're howardbrownhealth.org. We're a community health clinic here in the Chicago area. We have clinics that range from the south side all the way down on 63rd, all the way up to the north side at like Clark and Devon. And we have one clinic in Humboldt Park. You do not, we're an LGBTQ focused health center. That's our mission, but that is not the only population of people we take care of. We are happy to take care of any Chicagoan who thinks they want quality, comprehensive health care. We will see anyone regardless of their insurance status. That doesn't mean it's always cost free, but it means we can make it affordable for you and maybe even help connect you to health insurance.
Well, thank you for the good work that you're doing, Dr. Andrew Crone. Thank you so much for your time tonight.
All right.